Well, hello YouTube. Thank you for watching my channel, and please subscribe or like if you to like my video. um, I just wanted to give you a quick update what has been going on with me for the last couple of days. I had to go to MD Anderson because they do this with all with all cancer patients that have had renal cell carcinoma, which is a kidney cancer. They basically want you to come in on a regular schedule, like once a year, once every 6 months, and they want you to get evaluated to make sure the cancer hasn't come back. And so I had to do that. I try to schedule it all the time right at my anniversary, which is my anniversary for when I got diagnosed with kidney cancer, which is it's May. But here we are in July, and I did not get the letter that they sent me about my appointments, which I usually get. And I have to do this for 5 years. So I'm on year 4 or 3. Well, it's actually, oh, let me see. I believe it's year 3. So anyway, they basically did not get it to me because I moved. I didn't have the same address. So my address changed, and they ended up emailing me. So the powers of having a smartphone and a tablet where you can actually look up and there's an appointment that's already been set. So I'm like, oh, okay, I guess I need to go to this appointment. And I didn't really realize that it was at MD Anderson because I was trying to make another appointment in the Cypress area because it's so long to drive that far. Plus, I just had surgery like 4 weeks ago, so I'm not really good at driving, and I'm on pain medication, so I shouldn't be driving. So it was really hard for me to try to find someone who's going to take me, and it ended up having to be a friend of mine who literally just got back from going on vacation, and I spent the night at her house, and in the morning she took me to MD Anderson. I wanted to just say real quick, one of the things that I do not like about MD Anderson is that it's so large, and if you have to get from place to place, sometimes, especially after you just have had surgery, or if you're just not able to walk really good, whatever the reason, it's a lot of walking you have to do through MD Anderson to get to appointment, just to get from your car to appointment. And I know they have valet that's $15 every time you come. That's expensive. But if you don't do the valet, you got to do parking, and parking's really expensive too. So, make a long story short, when you're walking and you have, an appointment you got to get to, it's really, really difficult to try to find the appointment, try to make sure that you're able to physically walk to get to the appointment, and then, that you don't miss the appointment. So, it's a little it's very stressful actually for me. And then just being at MD Anderson with other cancer patients, it kind of can make you feel scared and anxious about it. And so for me, it's like I do not look forward to it at all. I do not look forward to going to MD Anderson. I do not look forward to, all the tests I got to take. And I definitely don't look forward to the drive because it's like, from my house, it's about 60 minutes, 60 minutes. And it's, and especially in the morning, it's really bad. So, what I do like about MD Anderson, though, is that every now and then, you'll see some amazing patient that is surviving the struggle, and it inspires you. It's like you can't be blind to that. When you see someone who doesn't have a leg or an arm or both maybe missing, and or you just see a patient, like it was amazing because I'm like in a lot of pain, and because I had done a lot of walking, and I was just hurting still from my surgery, and I didn't take the pain medicine, and I hadn't eaten anything because they wanted me to have an empty stomach, so I hadn't eaten anything, and I'm trying to go to the cafeteria, and I'm just like in a lot of pain. I'm just like, oh, it hurts so bad. And as I'm in pain walking, I see a woman who's bald, and she's running. And she's a patient that's in the hospital, but she just decided she was going to go jogging because she couldn't go out and jog or anything. So she was literally running around in the hospital with her jogging shoes on and everything. And it just made me think to myself, she may have pain as well, you know, and she's jogging. So I got to do a little better. And then I see a man who is his body is like emaciated, and he just didn't look well at all. And you could just tell he was really, really sick. And although he wasn't, visibly, like I didn't know exactly what was wrong with him, it wasn't like, you know, you're wearing a sign to say that you have something, but you just can see that he is visibly sick, and just very thin and frail looking. And he was probably about the same age as me. And just puts it in perspective, I'm like thinking, okay. And I continue to walk towards the cafeteria. And this was the coolest thing because when we were in the hospital, there were some cancer patients that were children, that were girls, probably about, I don't know, 10 or 12 of them. And they were walking through the hospital in complete Disney princess gear. And I thought that was just, it was just amazing that someone thought, let me just get these kids all fixed up. And I'm pretty sure it was Child Life, because Child Life for these cancer patients makes their day, I'm sure. But I'm sure they just came in with the princess dresses and did their hair and makeup and put crowns on them. And I mean, there was everything from Cinderella, Snow White, all the way to, of course, Elsa, and the one from not Mulan, but Muna. I can't remember her name, but the Hawaiian-looking Samoan princess. And I mean, they were just beautiful and all dressed up with their gowns and with their tiaras. And when you lose your hair to, if it's chemotherapy or if it's lupus or whatever you're losing it to, and I'm losing patches of mine, so it's really hard. But when you have someone who comes in and puts on a cute wig and makes you feel pretty, and then you get to walk around the hospital and just be like, look at us. I'm sure that made their day, and it made my day because it made me feel like, okay, no matter how or what you're going through, you can still be beautiful. You can still have, that smile on your face and take the time to make yourself look glamorous. And it made me feel good. It really did. So the things that I love about MD Anderson is that when you see the patients, you can't help but be like, wow. It just really puts it in perspective. I am a cancer survivor as long as I have breath in my body. And I am a fighter because I'm going to the hospital and I'm making sure that I'm doing my best that I can do at that time, whatever it is that they tell me to do. I'm trying my hardest to do it. And that makes all the difference in the long run. So the fact that they actually don't have, inexpensive parking, they don't have, a smaller place for you to get to your appointments, and you got to walk a lot. And I saw people in wheelchairs. I just didn't want to take a wheelchair from someone who'd be really, really needing a wheelchair. So of course I didn't get one. And it's hard for me to even imagine being pushed around in a wheelchair. I don't want to bother people and ask them to push you around in a wheelchair. So you push yourself a little bit more because you don't want to feel that dependent, So I probably should have got a wheelchair, and that would have made a difference. But, the little things that they do, like I was really, really cold because I had anemia, and they had a hard time getting my IV started. They had a hard time getting blood from me. So, when I sat down to wait for my MRI, I'm like, okay, I'm really cold. I'm freezing. And the lady said, well, let me get you warm blankets. So she got me these really nice warm blankets. And as I sat there and had to drink all this stuff, this contrast, it was like, oh my God. And it was nice to have that warm blanket, It was really nice to have it. So anyway, that kind of treatment when you're at MD Anderson, Oh yeah, another thing, when I was changing to get ready to go to my CT, I was changing to, take off my clothes. And they had in there, I wish they had magazines because you have to wait. And so it's kind of like you're sitting there, you can't use your phone, you can't use your tablet because you don't have the access. And it's like, it'd be nice if they had some magazines. Magazines would be helpful, or books, or whatever. But they did have this poster on the wall that really did help me because it was telling the it was telling the staff how to treat patients. And I just thought to myself, it's kind of weird that it's in here in a waiting area for patients who were getting ready to go to their CT or the MRI or whatever. But, for me, I was reading it thinking the fact that it's there, the fact that they are trying to help the caregivers understand what it's like to be a patient. And it was like little things that they said. They said one of the things that you may not realize is a smile goes a long way. And speaking to someone in the hallway, asking if you could help them, is important when you're dealing with patients that or cancer patients. And then they also said, make sure that when you talk to them, you explain that you're on their side. You're here to serve them, and the best way to serve them is asking them what it is you need. What can I do to make you more comfortable? What I love about Methodist Hospital a lot is they always say whenever, I mean, everyone does this. Whenever I say, oh, thank you, oh, my pleasure, my pleasure. And it's that kind of attitude that really, you know, it makes me remember to say that as well to people because it is a pleasure to help someone when they're in need. In my opinion, it makes you closer to God. And when I used to work in the hospital and I used to take care of patients, I would think of myself as doing a service job to the Lord, to God, you know, and wiping someone's butt, that is something no one wants to do, but it's something that has to be done. And I'm honored enough to be able to say, okay, I can do this for this person. I did it for a lot of people, as well as, doing things like, drawing blood and making sure you don't hurt them, and trying to be very gentle and, explaining to them that, you're doing your best and you're trying. All of that is important when you're dealing with, patients. Because, when you just go in there and you grab their arm and you're like, okay, let me get their blood, it's like you're not even having a conversation. And when I was there, I remember there was my phlebotomist who was so warm, and I just really wish I got her name. But she was just so warm, and it was almost like as she's getting my blood, having a conversation with an old friend, and then realizing I got a little poke, and then I didn't even think about anything else. We're just having a conversation. And next thing you know, she's done. And I'm like, oh, well, I better let you get back to your job. And she was really, really sweet and really helpful and treated me as if I was like a friend of hers. And then there was the nurse who did my IV, and she was very good too. And she was very, very warm. And, her name was Miss Kimball. And she was just wonderful. Karen Kimball. And I really appreciated her. And I'm going to write a letter saying that as well. And that's another thing. If you have any healthcare giver that helps you, one of the best things I think we can do is take the time to email whoever is the head of that department and acknowledge that. So that way they will get some kind of reward, hopefully monetary, from their boss to say, you know what, you did a good job, you were recognized, for that. It's almost like giving a tip to a caregiver. You're not supposed to give them any money. This is their job. They're not supposed to, give them money. But when they do a little more than what is expected, and when they take the time to really treat you like you're, not just a number, you're a real human being, like a family member or a friend, when they take the time to do that, I think it's something that needs to be recognized because their bosses are not sitting there watching them and know who is doing that and who's not doing that. They're just going according to whatever the patients do. And most of the time, patients are going to complain, or, that's just the normal thing. They're going to say, oh, well, this wasn't right, that wasn't right. The same way I started my video talking about things I don't like about MD Anderson. Well, once you get to the core of it, which is the employees, and you see that they're human, they're human. They're trying their best to make this job work for them. And it's not an easy job, you know. It's time consuming. It's like 12, 16-hour shifts on their feet. And it's really not probably what they wanted to do for the rest of their life. A lot of them didn't say, I want to be a phlebotomist when they were little kids. And so the ones who really are doing that kind of work are the ones who I think really need to be appreciated in some kind of real way with the patient, because no one's going to really know unless you say thank you. And I appreciated your work that you did. You did a great job. So I'm going to do that. I'm going to make sure I do that. I send a letter to MD Anderson and compliment the ones who really were great. And anyway, so after my MD Anderson ordeal, it's, you know, it starts at 9 o'clock in the morning. It doesn't end until 2 o'clock, and so it's an all-day affair of evaluations. I then will go back Wednesday to get my results, and hopefully I don't have any more cancer cells. Hopefully I'm not, I'm hoping that everything looks good. But it's a waiting game you have to go through. Like, you know, okay, I really hope it's going to be good. And there's nothing you can do at this point. It's like taking an exam and waiting for the scores, you know. So the hard part, I think, is that no one understands the anxiety of that unless you've gone through it. And people can say, oh, well, you know, I'll be praying for you, but they don't really understand that you're literally waiting, because it could be a malignant cancer. It could be, you know, a malignant, you know, malignancy means it's cancerous, but it could be, you know, something that has come up that's not as easy to cure as they did the last time by doing the surgery, you know, or it could be nothing, you know. And so you go from one extreme to the other. Oh, I'm worried about nothing. Why am I even, you know, thinking about this? Then there's the other extreme of, oh God, what if it, you know, is something? How am I going to handle that? I'm trying to go back to school. I'm trying to take care of my family. And how am I going to be able to handle that? You know, I might have to chemotherapy. You know, you're thinking all these things before it's even said to you. And that's just a part of being a cancer survivor, I think. You're always got those thoughts in your head, you know. And, you know, always kind of blame yourself, thinking, oh, I'm sure I could have, you know, lived healthier. I'm sure I should have got this done or that done. And, you know, and you're just thinking, like, if I had done this, then maybe I wouldn't be ever having cancer, you know. You just never know, really, until you've been there, how hard it is to go through that process. And if I'm talking to any other cancer patient, I'm sure you understand what I'm saying. But, so that's what I'm doing now. So Wednesday is the date that I will be, today is Saturday. So I have a couple of days before I can get my results back, which means I have to go all the way back to MD Anderson and find a ride to get there. And I'm thinking I might try to drive it by myself, because I don't want to bother anyone again. It's really hard to ask people to drive you, and it just makes you feel, you know, really bad. So I'm going to try to not take my medication and just drive myself and get my results, and I will notify you guys, let you know. Okay? Thank you very much for watching my video. I hope it can be helpful to someone. And I'm going to try to have a good day today. Yesterday was a really hard day. So I put myself together thinking, okay, I'm going to get out the house, do some errands, and not overdo it, and then come home and rest. And I'm hoping I can get that done. So it's time for me to go. I appreciate y'all. Please give me a thumbs up if you do like the video. And if you have any comments, please share. And I'd love it if you could subscribe as well. Thank you for listening, and have a great day.